My name is Claire Elgart. So the condition I decided to do some research on and present is hypothyroidism. This endocrine disorder affects the thyroid gland. It affects 1 in 300 people in the United States. And some causes of hypothyroidism include presence of an autoimmune disease such as Hashimoto's thyroiditis, which can cause the antibodies to basically attack their own tissues, specifically the tissues of the thyroid gland, and then that reduces the function of that gland. Another cause is the body's over response to treating the hypersecretion of thyroid hormones, or hyperthyroidism. So over treating this can actually lead to hypothyroidism if levels are lowered too much. Thyroid surgery or radiation to the thyroid gland can also limit or completely inhibit the production of thyroid hormones, leading to hypothyroidism. Specifically, this is when there is a deficiency in the thyroid gland, which is the definition of hypothyroidism. And when diagnosed for infants, it's specifically called cretinism. Symptoms will not be noticed immediately after birth, but shortly after birth. And some symptoms can include jaundice, dyspnea, and hoarse crying. And those are just a few of the symptoms that you can see. When it's left untreated, it can lead to failure to develop properly or grow properly. It can lead to mental retardation, abnormal bone formation, and just impaired growth. So some ways to diagnose hypothyroidism are tests such as the thyroid function test, abbreviated as TFT. That's just blood work that will measure the thyroid hormones such as thyroxine and TSH to detect thyroid function. Another test that can be used to diagnose is a radioactive iodine uptake test. This can be performed in iodine. Iodine is intravenously administered, and then the levels of radioactivity of the thyroid is measured through the ability of the thyroid to take up the iodine from the blood. This can, hypothyroidism can be treated through hormone replacement therapy, and this is specific to increasing the thyroid hormones. This medication can be known as levothyroxine. That's one of the medications that can be used to increase those thyroid hormones. Another treatment method can be dietary changes that increase an individual's uptake of iodine. That can also be an iodine supplement that can be added. In adult hypothyroidism, when it's diagnosed, is known as myxedemia, and symptoms can be seen as weight gain, fatigue, muscle pain, goiter, bradycardia, and that's just a few of the many symptoms that you can see. Diagnosis in adults can be done using the same test as previously discussed for infants, so through the blood work, thyroid function test, or the radioactive iodine uptake test as well. It's just as important to treat hypothyroidism in adults so it does not cause further complications.